Hello and welcome to the first Q&A, live Q&A that we've done here on Under the Wire. My name is Meryl Dorey, and I'd like to welcome you and thank you for your questions before the event and also for joining me tonight. I see that there are probably some new questions that have been added. I'm going to try to get to as many questions as possible, but I have all of the questions here that were asked previously, so I'd like to start with them, please. Hang on just one second. I don't know why I just got a notification. I have Do Not Disturb turned on. If you hear notifications, I'm sorry, I don't know what they're about, and I'm not going to look now. Okay, thank you. So the first question we've got is from Liz. I am hearing different things about the virus staying in the air. My thought is to wear a mask because if someone coughs and sneezes and doesn't cover their mouth, which lots of them don't, and an air conditioner is running and circulating around, it's possible to breathe it in. What are your thoughts on this? Now, my thoughts on this, Liz, are probably different from the average doctor or most people in the community. And I have to tell you that I've had an evolving um, impression about what viruses are and how they actually work over many years. There is a book that I recommend, and it's not easy to get because it is out of print. I have a copy, and I'm not lending it out to anyone. I got to tell you that. But you can probably request it from the library, and it's called Fear of the Invisible by Jan Roberts. And it is one of the most brilliant books on this subject that I've read to date. Basically, the medical community believes that viruses, which are not living tissue, they don't replicate, they don't respire, they're not alive. They are dead bits of protein in a fat envelope. Basically, that's what they are. That they somehow get into our body, infect our cells, and they are pathogenic. In other words, they cause disease, and we have to attack them, fight them, poison them, do everything we can to get rid of them, and vaccinate against them to try and make sure that we don't get them in the first place. That is the mainstream view of viruses, but it's not correct. I don't know all the issues surrounding viruses, but what I do know is that our bodies produce viruses. And the reason they produce viruses is to reduce toxicity. So, just like a lot of bacteria in our gut are basically garbage disposal systems for our bodies, they help us break down our food, they help us process things, they break down enzymes, they do a lot of things that if we didn't have bacteria, we would basically die. Well, bacteria make viruses, and other cells in our body make viruses. So you would think that if our bodies make viruses, we have a relationship with them already that is one that um, basically is not a pathogenic relationship. It can be if things get out of balance, if we don't maintain homeostasis, if we eat bad food, if we live in a very polluted environment. Um, yes, then viruses which are made by our body can become pathogenic and can possibly cause disease, but we don't catch them from the environment as far as anything that I've been able to read goes. Now, I've linked to a video. I hope the link worked because I edited the post to put the video link there. It was from Tom Barnett, who is a local naturopath, and he was a candidate for the Involuntary Medical Objectors Party. I don't think that's the name anymore. I forgot what their new name is. I'm sorry. But he's put together a really good video about why you cannot catch viruses. According to him, and I believe that to be the case too, viruses and bacteria and fungi and all sorts of things that we're told are pathogenic and disease causing are on surfaces on our bodies, on surfaces around us all the time. They are in our bodies, they are on our bodies, they are everywhere, and they don't cause disease unless some other conditions um, are around there. Using a mask may prevent you from spreading the disease to other people if it is a special kind of mask that is small, that is, viruses are really tiny, really, really tiny, like submicroscopic. So if you have a special mask that is specifically made for preventing the passage of viruses, then wearing that mask will prevent you, should you be ill, from excreting viruses into the air. But the masks that most people are wearing, the masks you buy from the supermarkets, the masks you buy from the chemist shop, the surgical masks, they are very porous. They don't even prevent all bacteria from passing through, and bacteria are many times bigger than a virus would be. So, using a mask is probably not going to be that helpful unless you're sick, and then it may help you from passing the viruses on. But that said, I've yet to see proof that people actually contract viruses from one to another. So that's my thoughts on that. If it makes you feel better to wear a mask, go ahead and do it. I think we're probably just around the corner from the government requiring us all to wear masks whenever we go out. And if we have to, if that's the only way we're going to be allowed out of our houses in this fascist dictatorship, then we might have to do that. It's a hell of a lot better than compulsory vaccination. Okay, I'm going to go to the next question now, and I'm covering these things quite quickly because I do want to get through all the questions. I have read that the flu shot had a form of coronavirus in it, which may be why COVID-19 is spreading so much. But it was explained to me today that this may not be true for the Australian flu shot. Can you explain in basic terms why someone who has had the flu shot is more susceptible to get sick from many other illnesses? Also, what it means to have antibodies present regarding testing. That's a lot of questions. Okay, I have heard people saying that the flu shot has been contaminated with coronaviruses. And I have tried to actually find that information, and I haven't been able to find it. But that said, there is a lot of information about contamination of the flu shot. And I do have hang on a second. Okay, this is from 2004, where an incredible number of flu vaccines had to be destroyed. 48 million flu vaccines had to be destroyed because they were found to be contaminated. Now, it did not say what they were contaminated with, but they were contaminated. And the 2009 flu vaccine that that we used in Australia, the CSL flu vaccine that caused all those reactions and a death and at least one case of permanent brain damage in Sababat, WA, that was also contaminated, though what the government did in that case was they said, well, we're going to give the information that we've got on this contamination to CSL, who is the vaccine manufacturer, and ask them to investigate what they think caused this contamination. And you wouldn't want to know it. After a year of trying to find out, supposedly trying to find out what had caused the contamination, CSL came back and said, sorry, we can't work it out. And the government in Australia said, that's all right, mate, you did your best. That's okay. So can viruses be contaminated? Sorry, can vaccines, including the flu vaccine, be contaminated? Indeed, they can be, and they are. The flu vaccine that we're using right now is cultured on fetal chick embryos, so eggs basically. And they do pick up retroviruses and other viruses from the eggs, proteins from the eggs. They can sometimes be contaminated by the laboratories. Can that contamination include coronavirus? Anything is possible, but I haven't yet seen anything to say that that's the case. Now, why are people who got the flu shot more susceptible than more susceptible to respiratory illness than people who did not get the flu shot? And there are several studies, and I've only got a few of them here. And I've got to say thank you to Leo because he put some fantastic screenshots in the thread for this Q&A. I had these studies, but the screenshots are great because they actually pull out the results of the study. This is a 2012 Hong Kong study, and this has been cited quite often. Flu shots increase the risk of non-flu respiratory infections 4.4 times and tripled flu infections. So, in other words, we are giving people a flu vaccine because we're told that that's the best way to reduce the toll of influenza, reduce the deaths, reduce the morbidity, stop people from getting it. But study after study has similar results to this one. Non-flu respiratory infections, which would include coronavirus, it would include things like RSV, it would include a whole bunch of different bronchitis and pneumonia and all kinds of things that can follow respiratory infections, were up 4.4 times in the group that got the flu vaccine and tripled. Flu infections actually tripled over the group that didn't get the flu vaccine. So if the vaccine is meant to prevent infections, mortality, and morbidity from influenza, it didn't work. Um, Here's another study. 2018 flu shots increase the risk again of non-flu acute respiratory illness in children. As of about 10 years ago in the United States and a little bit later in Australia, but now, um, children over the age of 6 months are targeted with flu vaccines. When the flu vaccine was first introduced, we were told that children and healthy adults did not need to take the vaccine because in those age groups, an infection with influenza was not deadly. All it did was allow you to develop long term immunity. But I guess again, if you have a product, you want the market to be as big as you possibly can so that you get more money for that product. So now children are targeted. And in this study, the risk of non-flu, so in other words, respiratory illnesses caused by other viruses or bacteria other than influenza, were increased substantially in children who had been vaccinated as compared with children who had not been vaccinated. Um, the Mawson study, now I don't have the screenshot here, but this is the homeschool study that compared fully vaccinated and fully unvaccinated children. And I think, I can't read it, it's too small, but this is freely available to download online. If you take down the title, you'll be able to get it. I think it was 30 times the rate of allergic rhinitis, which is basically what we used to call hay fever, in those who were vaccinated versus the unvaccinated, and a much higher rate of respiratory infections. I think it was around 5 times higher in the vaccinated as compared with the unvaccinated. And we don't really know why this is the case, but this is a recent study that came out. I think it was only published in, let me see, received June 2019, published in October 2019. So this is a study that was done by the Department of Defense in the United States, and it's a fairly decent sized study. And what they found was that there was a 36% increased risk of coronavirus infections in servicemen who had received the flu vaccine. And so the what happened was there was a 36% increase, and they call this viral interference. I'm still trying to get my head around exactly what viral interference means. The best that I've been able to get, and it is a complex equation, is that when you are vaccinated against one thing, because it takes up a large part of your immune system, it leaves you more susceptible to other infections. Now, they're calling this viral interference. This is something that I have been reading about for quite some time with all vaccines, not just flu vaccines, that flu vaccines suppress immunity and they leave your immune system open for opportunistic infections, which, from what I had been reading for many years, were things like meningitis, septicemia, opportunistic bacterial infections. But here we have these sorts of problems with viral infections as well. And I will be coming back to this study a little bit later on in the Q&A because there is something else that I need to discuss about this. But through viral interference, we are being told that being vaccinated against influenza greatly increases your risk of coronavirus infections, not just COVID-19, but all coronavirus infections, which makes what the government is doing right now in aged care, where they're requiring that all visitors, all residents, and all employees of aged care facilities be vaccinated against influenza in order to go to the facility or work to the facility or live there. Um, well, all they're doing is increasing the risk that coronavirus is going to spread through the facility if you believe the results of this government study. And I haven't yet seen anyone give any explanation as to why this study is not correct. So, what does it mean to have antibodies present? Not a whole hell of a lot. It means you've been exposed to something. Antibodies are and have been for many decades used as a proxy for immunity. So, if you are tested for, let's say, measles, you have been exposed to measles or you've been vaccinated against measles and you're tested and you're found to have measles antibodies, it is determined that that means you're immune to measles. Um, if you then come down with measles, what does that mean? It means that the antibodies did not protect you. And we know that antibodies are not protective. There are several different tests that are being used in this current coronavirus outbreak. An antibody test is one of them, though it's not being used commonly. The antibody test, from what I understand, can determine that you are, can determine that you have coronavirus in your body, but it cannot determine what type of coronavirus it is. And there are several different strains. I spoke with Dr. Loretta Bolgan the other night. I did a very long interview with her. I'm in the process of editing it, and I'm going to be putting it up shortly. Not tonight. Not tonight. I have to also get it captioned because she's got a fairly heavy accent. So I want to make sure everybody can understand what she's saying because she says some brilliant things. But she talked about the coronavirus, and she said that what happens is, and this goes back to what I said earlier about our bodies actually making viruses. She said everybody who's tested for coronavirus has a slightly different strain in their body, and that could very well be because we are making the coronavirus in our body. And we're making it for a reason. It could be helping us get rid of things that are in our lungs. It's helping us get rid of toxicity. And here we are trying to destroy it and fight it. But I hope I answered those questions. I'm going to go on to question 3, Julia. Thank you. Now, this one I'm going to have to leave because, to be honest with you, I did not have time. I wanted to research this today, and then I got delivery of all the Vax 2 DVDs, and I had to go through and start doing a whole lot of work with that. We're sending them out, and I needed to get a lot of things done with this. James Lyons Wheeler has been talking about the SARS vaccine mouse trials. He's also been talking about the spike protein. I don't know enough about this to answer your question. What I would really like to do, and I've been corresponding with James, is I would like to get James Lyons Wheeler onto Under the Wire to answer your question and to tell us about his impression of the coronavirus, SARS, all of these things. So, Bruce, if you will excuse me for not answering your question tonight, I am really sorry. I didn't want to say something that I don't know for sure to be true. And I feel that because this is something that James Lyons Wheeler has been speaking about extensively for a period of weeks, it would be best to get him to talk about this. And aside from that, I really want to talk with him on Under the Wire. So, yeah. Okay. Lyndall, love you, darling. You know what? Being intelligent is knowing when to say you don't know, and you are going to get more information. So if you think you have an answer to that question, go for it, baby. Okay, Jackie Tung, with them announcing they are going to trial using a TB vaccine, do you have information on that vaccine, i.e., side effects, ingredients, etc.? Thank you. Well, Jackie, actually, I do. The tuberculosis vaccine, or BCG vaccine, has been used for a very long time. It is one of the oldest vaccines we have, other than smallpox. And it is so ineffective at preventing tuberculosis that it has been estimated to have a 0% efficacy. And there are vaccines that are less effective than that. The flu vaccine, for example, in some studies has had a negative 50% efficacy, which means you are twice as likely to get influenza if you get the vaccine than if you are unvaccinated. But the BCG vaccine is classed as 0% effective in large studies that were done in India. Now, here, I want to just talk about how crazy this is. Um, I'll call you whatever I want to, darling. Um, we have flu vaccines that change every single year because when there is a slight change in the protein envelope of the influenza virus, we are told that last year's vaccine will not work to protect you against that virus. And so we have to have a new vaccine every single year for flu. Here we have a vaccine for a totally different organism. It's not even a virus. BCG is not a virus. Um, it's a bacterium. So we are being told that the BCG vaccine may protect against SARS-CoV-2. Now, it is hoped the BCG vaccine will increase the body's immunity against coronavirus, SARS-CoV-2. Well, I hope that I will win $80 million in the lottery, but that doesn't mean I'm going to win it. And it doesn't mean that the BCG vaccine is going to do anything to prevent infection with a viral illness. Um, but the BCG vaccine is currently being used against several other diseases, which it's not supposed to be used against. And I believe that one of the reasons why this vaccine has been used in trying to prevent allergies, trying to treat diabetes, and trying to treat cancer is because we have it. It's not being used as a vaccine. We do not have the BCG on the schedule. I think that Aboriginal and Torres Strait Islander communities do get the BCG vaccine, but other than being used as a travel vaccine, it is not used on a widespread basis. So, what evidence do we have that it's going to be able to treat SARS? Absolutely none. So, what side effects are associated? I hope I still have this page. Okay, here we go. Now, these are things that you can find by doing a search online as well. This is drugs.com, but if you want to find the ingredients, the interactions, the known side effects, the contraindications for any drug or vaccine, what I recommend you do is go into Google or Google Scholar and do a search for the name of it, so BCG, prescribing information. Don't look for the consumer information because most of the data is left off of the consumer information. Look for the prescribing information. That's the information given to doctors. So here we go. This is the BCG vaccine. More common side effects: blood in urine, fever and chills, frequent urge to urinate, increased frequency of urination, joint pain, nausea and vomiting, painful urination. So it seems to affect the bladder and the system down there. Rare symptoms are cough and skin rash. 10% of the people who get this have some sort of urogenital um, uh, symptoms of some kind. Uh, Bladder constriction, pyuria, uretic obstruction, um, orchitis, which is, that can be severe, but that's a rare side effect. But it does seem to have an effect on that area of the body. But all the side effects will be listed. All the known side effects will be listed here. This is not a benign treatment. And the idea that they believe somehow that it's going to be useful in preventing infections with a totally different organism, a virus, not a bacterium, I honestly don't understand why. So I hope that's been helpful, Jackie. Stavros, devil's advocate. Yeah, I know. My husband does that all the time. Why are you telling people to go against government regulations and endanger the public by telling us to ignore what we are being told and to gather in groups? Isn't this how the virus is spreading? Now, I have never told anyone to do that. I have simply said that the government telling us that we should not be able to, that we should be restricted from, prohibited from going out in public is a tyranny. It is not a democratic government, and there is no evidence. And I have shared an awful, you may not be able to see them, Stavros. I know they're on memes, so I think they're all saved as images, not as text. But if you listen to the High Wire last week on Friday, well, Friday in Australia, Thursday in the US, I'm not sure where you are. If you listened to the High Wire, you would have heard many of these memes from the doctors read by Del Bigtree. And the fact is, there are a lot of countries that are not doing what Australia is doing. Taiwan is one. Taiwan has not done this total shutdown. Yes, they are asking people to wear masks, and they are asking people to be careful if they're sick and not to go out. That's common sense. My grandmother told me to do that. You know, my ancestors all stayed home when they were sick. That is common sense, not only for you, but if you believe that you can spread an infection, then you don't want to do that. Take care of yourself, take care of others by staying home. The idea right now, I mean, there was an incident that I shared this morning on my personal page um, in Centennial Park in Queensland, where the police were driving through the park, and if someone was lying on the grass, catching the sun, you know, just lying there napping or reading a book or sleeping, the police were moving them on. Now, why would that be? There was no one near them. They were absolutely separated, not by 1.5 meters, but by many meters. Why? There is no common sense to this. This is simply a power play. This has nothing to do with health. This has to do with control. And I am absolutely against the government trying to control my life and the lives of my family and my fellow citizens of Australia. So I say to people, we need to get answers. We need to find out why the government is doing this, what they're basing this policy on. And before they start arresting people or fining them for being out in public, we need to find out why they feel that this is going to be effective. And to date, they have not shared any information about that. It's simply, follow our orders or else. And that's not good enough. I did not sign up to come to Australia to live in a Nazi fascist dictatorship. I signed up to live in a democracy, and I want to have a democracy. So I hope that helped. Um, Natalie Yates, I'd like to know how long the virus can survive on its host. I have heard that it will survive for days on plastics, glass. I don't understand how this is possible without a living host. And this is the thing, viruses are not alive. So when you talk about survival, they can survive because they're not alive to begin with, but they can be viable. And nobody really knows how long they can be viable for, but there are certain things that will decrease the time that they're viable for. They seem to be quite sensitive to temperature, so heat can affect them. And a lot of people believe that's why the winter time is when we have higher rates of influenza, because like coronavirus, the flu virus is susceptible to heat. Um, the other thing is that, sorry, because it has a fatty outside, a fatty envelope that surrounds it, if you can break down the fat, then all you've got left is these little bits of genetic material. So things that break down fat, like soap and water, one of the most effective ways to kill viruses on surfaces. You do not need those antiseptic, uh, uh, antibacterial things that actually increase antibiotic resistance. Simple soap and water is shown to be very effective. at reducing the viability of any viruses and bacteria that might be on surfaces. So simple precautions, again, that our grandmothers and mothers told us about are basically what's needed here, and a heck of a lot less panic. Um, the panic is not helping anyone. Okay, Kaylee, what I want to know is whether anyone is watching the government for mandatory vaccines being passed in while we all look at the coronavirus. Look over there, not here. And are there any moves in place to stop mandatory vaccines? Given we haven't been able to stop anything else they have done so far, I am interested in hearing the next step. Me too. As someone who spent 5 years basically fighting against uh, any form of mandatory vaccination, any form of discrimination, medical discrimination, any fines or penalties for parents who did what they felt was best for their children, I have to tell you that if we had had a lot more people standing up with us and taking action with us, that we would have been successful at defeating no jab, no pay. We would have been successful at defeating no jab, no play. Every single day, we are getting, I don't know, a dozen emails and messages from people who work in aged care who are now looking at losing their job, and they want to know what the AVN is going to do for them. And I got to tell you, there's nothing we can do for them. They have to do for themselves. Walk out. Get together with your workmates. You're going to lose your job anyway. You're either going to have to get vaccinated, which, according to what most of you are saying, you're never going to do. So get together with your workmates. Say, do you think I should be forced kicking and screaming to take something into my body that I think is going to harm me? And if you say no, then support me. Let's leave. They need you more than you need them right now. So I think that what will be really successful at stopping this new legislation that is requiring that people take these vaccines if they want to work in aged care is a strike, a nationwide strike by everybody who works in aged care facilities, from the nurses to the doctors to the kitchen staff to the office staff, the administrative staff. Walk out. Do it. Organize it. We're not going to organize it for you. You organize it for you. As for who's watching the legislation, put your hand up, somebody. We are a small group of incredibly overworked people. We need your help. If somebody wants to put their hand up and say, I will watch Hansard federally, I will watch Hansard in New South Wales, in Victoria, in Queensland, that would be fantastic. We would be so grateful to have that kind of help. And as far as what the next step is, let's work together and work that out. We need to be strategic. We have large numbers of people who are supporting, but they are all sitting on their hands waiting for someone else to do it for them. And I've got news for you. Nobody's going to do it for you. Look at your children. Do you want them 10 years down the track, when they live in a fascist dictatorship, to look at you and say, gee, mom or dad, could you have done something to stop this, and why didn't you? I don't want my kids to ever say that to me. So I am fighting for my family and my children. We all need to do the same. If you won't do it for them, I don't know what to say. So we need to be proactive, and we need to make sure that we get our voices heard on this. And like I said, a nationwide strike of aged care workers in all ranks needs to take place. It's the only thing that's going to stop this. And trust me, if you all walk out, even if only a large percentage of you walk out, this legislation is going to go out the window, because there's nobody to take your place. They need you. You don't need them. Okay. So question 8, Ruby West. All right, Ruby, I think I've already answered this. My brother is a handyman in a retirement village. He doesn't want to be injected Is there an option to only work outside the grounds to avoid vaccination? If so, what are his rights? How can this be negotiated? Ruby, does he have a contract? If he has a contract, he needs to look at it. If he signed a contract with certain conditions, it's my understanding that it's very difficult, if not impossible, for the government to change those conditions. The only way they're doing it is because they declared an emergency. So he needs to maybe speak with a lawyer, speak with his union if he's part of a union, and ask them these questions. Negotiating, I don't think he's going to be able to negotiate. Let him join the walkout. Let him help organize the walkout for his facility. So we need to get active on this issue. We really, really do. And I have to apologize for not answering questions or putting comments on the screen here. I'm trying to get through all these questions first, and then I can look through your comments, answer some of them, and answer some more questions. This one, do you remember the Department of Defense article that I spoke about earlier, the one that talked about viral interference? This is from Maria, and she shared it, and she got this warning from Facebook. I've shared this, the AVN has shared this, several other groups have shared this, and we all got the same number of warnings. False information found in your post claims that flu vaccine increases coronavirus infections is unsupported, misinterprets scientific studies. Now, they had three fact checkers, I'm going to call them, even though I don't think they're really fact checkers. They're just vaccine supporters who they went to make this determination about this study. Now, this is a study that was published in a peer-reviewed journal. As far as I know, the study was conducted by the U.S. government because it was a Department of Defense study, and not one person who did this fact checking oh, you got that too, Amber. I know it's going out everywhere. Pardon me. Not one person who complained about this study in the group of three fact checkers gave any evidence that the information was incorrect. What they said is that it hasn't been replicated. Now, this study was just published in October, okay? So it's only a few months ago. Who's going to have replicated it since then? And since when do you need a study to be replicated in order for the study to be valid? That's why it goes through peer review. The peer reviewers look at the information in the study and say, yes, this is valid. No, this is not. But what I found really, really interesting, I looked at the three fact checkers, and one of them works for the, oh gosh, I forgot the name of it now. It's an Australian Institute for Immunology. Oh God, it's gone right out of my head. But she works for this institute in Australia, and in 2015, that institute published a study on viral interference after flu vaccination in ferrets. So if she is saying this has not been replicated, well, that study is actually replicating the animal study that institute, the Doherty Institute, Peter Doherty, the Doherty Institute did a study in 2015 on this very subject. It was not using humans, it was using ferrets, and they talked about how the flu vaccine can cause this viral interference. So is it that they really think that the study is somehow flawed, or are they concerned because it is such a good study and such a firm result that they're trying somehow to prevent people from accessing this information? Maria, I think that's the case myself. Whether it is or not is up to everyone to decide. But it is quite amazing. Also, I do have to let you know at this juncture that, and I know I've said this before, but the number of people in our community who have had their accounts on Facebook permanently deleted over the last 48 hours is quite amazing. So if you do find that the AVN page disappears, that my page disappears, that no compulsory vaccination is gone, please be aware that the AVN has a newsletter that we run via our own website, avn.org.au. Make sure you go there and sign up for the newsletter, because when social media kicks us out, that will be maybe the only way, but the best and most direct way to stay in touch with what's happening. And we will also be putting Under the Wire on the website at all times so that people can always see it. So just be aware of that. Now, I'm just going to go over. Oh, that's the one I've already spoken about. And this is, let me just see what I had here because I know I had put a lot of, oh, yes. This is not a question from anybody, but I don't know if anybody saw this. This is an article in today's Sydney Morning Herald. And when I talked about how this is about control, 6 months in jail and an $11,000 fine for leaving home without a reasonable excuse. So now the government is saying that we need to have a reasonable excuse, reasonable according to whom, in order to simply leave our homes. And if we don't have that reasonable excuse, then we can have an arrest with 6 months in jail and an $11,000 fine. Um, I don't, I don't know if you guys find that concerning, but I think that's really concerning, and it scares the daylights out of me. This is inside Taiwan. This is a country right next door to China, and they are not doing social distancing. They are not closing down the government, and they are not having huge problems with COVID-19. They are using masks. As you can see, these are school children going to school with masks, and they are increasing the amount of sanitizers. But they are not doing what we're doing, and they are not seeing huge problems. And speaking of huge problems, I would love, now I don't want to get anyone into trouble, but we've been getting reports from people who've gone to hospitals around the country, both here and in the United States. We're being told that emergency departments are being overrun with coronavirus cases, that we're running out of respirators, we're running out of everything because there are so many people being treated for coronavirus. If you happen to go past a hospital and you have time to go and see what the emergency department looks like, I would really appreciate it if you would do that and let me know. You can message the page privately. We will not share your information. So please do that. Now, this is the information from Queensland on aged care. All of this information, I'll put all these links up at the top of the Q&A at the end. Like I said, I had some problems editing it, but this is the actual information. I also have a link, though I don't have the window open here, to the federal legislation that's going to be requiring, use of influenza vaccines from the 1st of May, and nobody in aged care facilities unless they're vaccinated. So that was all I had to cover. I'm going to scroll up through these comments. Wow, there's lots of comments. And I just want to see what I can answer that I haven't answered before. Thank you guys for sticking with me and for coming along tonight. Okay, here we go. I've gone past all of these. Oh, I've printed Greg Brown. Greg's comment is amazing. I printed it out, and time allowing, I'd like to read it. But if I don't get a chance to, please scroll up through this thread. And yeah, let's do that. Now, I'd like to deal with, let me just get my window together again and go here. Okay, here we go. Scott Blundell, seriously, 11,500 people have died in a month in northern Italy, and you are calling this a mild disease, and you see no evidence that we should be concerned by it. Can one of you volunteer to go to northern Italy? Sorry, it doesn't stay on the screen long enough. And give us a first-hand report. Are any of you willing to put your hands up and help in the emergency departments as the sick come in? No? Well, why do you ask a question if you're answering it? I would be very happy to go to northern Italy. I've always wanted to go to Europe. I've never been. Challenging my belief system, but you are you are a reckless endangerment to public health. You really are the worst person. Well, you know what? You're entitled to your opinion. It is a free country. And Scott, I hope that when I do put up the interview that I did with Dr. Loretta Bolgan from Corvelva, which is in northern Italy, where all of this is taking place, that you will watch it because I believe that your belief system is being challenged. We all have belief systems, we all have agendas. I think the difference is that I'm willing to learn from the information that is shared with me. Northern Italy is the dirtiest place in Europe. It has the worst air pollution, the worst water pollution, the worst soil pollution. They have really bad flu infections every single year in northern Italy with large numbers of deaths. They also have a very high rate of smoking in that age group. Almost everyone who died in northern Italy was over the age of 80, and they had as many as three comorbidities. Coronavirus was not put down as the cause of death on many of these death certificates. In fact, cancer was, or diabetes, or other conditions like that. What Loretta Bolgan said was that the pollution, the smoking, and the use of 5G, they had just turned on 5G in that part of Italy, all combined to cause a lot of problems in the elderly. Um, but like I said, they have bad flus every year in this part of Italy. And the number of deaths you're talking about, 11,500 deaths, first of all, many of them were not directly caused by coronavirus. But even if every single one of them was a coronavirus death, it was still fewer than the deaths from influenza on an average year in that region of Italy. So why are we closing down countries? Why are we practicing social distancing for coronavirus when we didn't do it for flu? Yeah, Mike McKinnon, sorry, Mick McKinnon. I assume you are aware that nearly all deaths in Italy are terminal folks with numerous conditions and died of many things. Not one case died because of coronavirus. They can only say they died and were positive. And that's true. If you look at the information from the articles that have been published, it said they died with coronavirus, not of coronavirus. And yes, the use of Tylenol or Panadol is a huge problem. It is recommended for these things to reduce fever. First of all, in viral infections, you do not want to reduce fever unless it's a life-threatening fever. I only know Fahrenheit. I know after 32 years, you think I'd know better. But, over 104, 105, you may want to do something to reduce fever. And even then, things like Tylenol and Panadol and Advil are terrible antipyretics. There are many other ways to reduce fever that are safer, but using these drugs in this situation can make the situation much worse. Plus, they were using antibiotics. They were assuming a secondary bacterial infection was going to occur, and antibiotics destroy the gut, suppress the immune system, and can make these infections far, far worse. Hi, Leah. This will be available afterwards, so if you miss the beginning, that's fine. Scott, I'm sorry that you think it's factually incorrect, but I think that you're wrong. Lyndall, qualifications have nothing to do with it. I've studied this issue from the medical literature for 30 years, and if you would like to debate me on this publicly, please let me know. I will pay for you to meet me anywhere in Australia once the quarantine is over. We will have a debate in front of a live audience. I saw vaguely when I was searching through that you are a medical doctor. I would love to debate you in front of a live audience. You name the MC, we will do it. We will have equal time, and I'm happy to do that. If you think that anything I'm saying is not correct, let's debate it. Okay? Put your money where your mouth is, or put my money where your mouth is. I will pay for your accommodation and airfare. I will pay for the venue. Let's do it. Okay, you make that claim, but I have my doubts. That's fine. I am not telling anyone that they should believe anything I say. I give links to what I refer to, and I am very happy for people to fact check me. And if you find that I've said something wrong, I'm happy to change it or to admit that I've made a mistake. Um, Okay, Lisa Charles, the way in which we code deaths, I wish I could find a way to make these things last longer. Sorry. The way in which we code deaths in our country is very generous in the sense that all the people who die in hospital with the coronavirus are deemed to be dying of coronavirus. That is really important. On reevaluation by the National Institutes of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of the patients who have died have at least one premorbidity. Many had two or three. And that is really important because if we are saying that these deaths are from coronavirus, we need to show proof that they actually are from coronavirus. So, Lisa, thank you for sharing that. I appreciate that. Um, Scott, I'm not a medical doctor. I'm not going to tend to the COVID positive. My job, my role is to provide information and research. If you are a medical doctor and you are tending to them, fabulous. Thank you so much. Stavros, a doctor friend sent me this email after I showed him the Science Direct article. The Science Direct article does not contradict itself, but is difficult for non-scientists to read and interpret accurately. Stavros, I'm sorry, I don't believe that. I think that the Science Direct article says exactly what we said it said. I will read through what you've said here. I don't have time to do that here. It's quite long. Um, but yeah, I don't believe that what your friend said is correct. But I will read through what you've written. I will reread that article, and I would love to talk to you and or him about it in the future. I'm very happy to do that. Lisa Charles, the death rate is overblown. There is no doubt about that. Even in the U.S., Deborah Birx, who is as pro-pharma as you can possibly imagine, is saying we've got to calm down. This thing is not as bad as what everybody is saying. But it's become like a steam train or a steamroller. It's picking up speed. It's got its own momentum, and it's very, very hard to stop that. Um, yeah, last I checked, starvation from poverty kills people 100% of the time. Crashing the economy and sending the world into another Great Depression is not warranted. And my understanding is even if we reopen tomorrow, there is going to be a depression, not a recession, but a depression. And that is going to cause an incredible amount of death and disability, way more than any infectious disease. Um, so, yeah, it's pretty bad. Uh, Linda, again, if you think that my information is inaccurate, debate me in public. You can contact me, the AVN Enquiries at avn.org.au. Just send me your location when you're available. I will set up the debate. You name the MC. I couldn't be fairer than that. Okay, let me just see what else. Thanks. Yeah. Julia, we don't need to prove qualifications to have a critical discussion. That's not the marker of intelligence. That's true. People who've graduated from medical school have a degree in what they were taught in medical school. They were not taught about vaccinations. This is a fact. This is what hundreds of doctors have said. They learned nothing in medical school about vaccinations. And all you need is an ability to read and research in order to understand this information. You do not need to be a doctor or a scientist to understand it. And some of the best scientists have been citizen scientists. So, yeah. Um, Let me just see. Here we go. Mandy Moo. In addition to what I said happened with my mom and having COVID-19 symptoms in November 2019, she was bullied into getting a flu shot before going to Europe. Was that just before she developed those symptoms, Mandy? I may not even see your answer because there's so many comments here. And I have to tell you a story now. I can't share too much about this because I haven't gotten permission from the person. But there is someone whose mother went into a nursing home in January. She's quite elderly, but she's, totally with it, not vaccinated. This woman is not vaccinated. She only went into the nursing home in January. She's been living with her daughter for quite a few years, but it became too much, so she put her in a nursing home, and she was visiting her every day. She's now been told that she's not allowed to go and visit her mother because she will not get the flu vaccine. Now, the mother has always used natural therapies, and she had her supplements, and her colloidal silver in her room. Now, these people are adults, okay? They've lived their whole lives. They deserve respect. The staff came in and removed her supplements and her colloidal silver. And what the woman did was she went to the nursing home and she took her mother out and she took her back home. And she's going to care for her at home. And I think that a lot of people, aside from the people who should walk out, like the employees, if you are not happy with the fact that you or your family are being forced to vaccinate, and it is possible for you, I know it's not possible for everyone, and many people work, and many elderly people have dementia and are very difficult to look after or have, medical conditions that they can't be cared for at home. So, but if it is possible, for you to bring your elderly relative home so that you don't have to ask permission to go and see them, so that they or you do not have to be vaccinated, then go ahead and do that, because honestly, I don't think any of us should be bribed or coerced. And the NHMRC has stated that coercion is not a valid way to get someone to take any medical procedure. So why are we allowing adults, intelligent adults, to be coerced? Um, okay. Oh, we've had a few trolls on here tonight, haven't we? I wasn't able to really keep up with this. Um, all right, let me see. Oh, Julia, no, many people are slacktivists who want others to save them. Sadly, I think that's true. But I also think people don't know how to become an activist. And, I've been an activist since I was in my early teens. I marched against the Vietnam War in my freshman year of high school. I was 14. And, I've been an activist my whole life. So it kind of comes naturally to me. But I do think it's something that people are afraid of. They're afraid to speak up, and I just think you need to get over that, because I've never heard the word slacktivist before, but I like it. But yeah, nobody's going to save you. You're going to have to save yourself. Okay, Stephen, if I think social distancing is not working and draconian crap, how about you walk the streets of New York or Italy and see how that works for you? I can't believe you lot. You buy me a ticket to Northern Italy, I'll be on that plane. Of course, we can't be on a plane because we're not even allowed to fly overseas right now. But do it after the epidemic. I'd love to go. Okay, thank you. Um, Let me just see. Sorry, I'm just looking through to see if there's any other questions. Everyone goes on about qualifications, but everyone seems to be happy to listen to Bill Bloody Gates. That is such a good point. Bill Gates is not a doctor, he's a billionaire. And he became a billionaire by stealing products from other people and by basically, you know, from what I understand. In my opinion, he was not a very nice man. So he's not anybody with any qualifications. But when Bill Gates talks about how we should have identifications injected into us so people know what vaccines we've gotten, no, everybody says, oh, yes, Bill, kowtow, kowtow. No, 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 no. Qualifications have nothing to do with anything. What has to do with something is what your knowledge is, what the science says. And the science is very clear on this, that the so-called pandemic, or as I prefer to call it, plandemic, is not the bubonic plague. It is not something that's going to kill half of Europe and half of the world. It is simply another flu-like illness. And there are many agendas at play here, and one of them is compulsory vaccination, and we need to be aware of that. Let me just see here. Um, the real deal with Tricky Tritty. Read the thousands of peer-reviewed studies which state vaccines are linked to serious health issues and extremely ineffective. In fact, all vaccines are ineffective. I've spoken about this before. The only thing vaccines are meant to do is induce the production of serum antibodies, and serum antibodies only indicate exposure. They do not indicate immunity. Melanie, anyone can pay to go to a university, and that's true. And a university education, while it's great in teaching you how to write papers and maybe do research, it's not going to teach you the information that you need. Um, Stephen Forbes, I, I came to hear counter views, but I'm now convinced you're a bunch of conspiracy theory, non qualified people who need to read left and right, not just left. What you don't seem to understand, Stephen, is that as far as I know, all of us started where you are, all of us vaccinated, or all of us believed strongly in vaccines. I did until my own child was vaccine injured. And then, and only then, did I start to investigate this. And I've been doing it for, like I said, well over 30 years. Most of us are ex vaxxers, not anti vaxxers. And we were open minded enough to look at this issue. And I don't judge anyone who vaccinates because I did vaccinate. I know exactly where you are. I know the fear that you're going through. And I know that if you were open minded enough to actually research this issue from both sides, which you apparently haven't done, that you may never change your mind, but at least you would understand our point of view and be more respectful towards it. So, Jesse Joy, you can watch the vitamin movie for free until the 4th of April. If you'd like to share a link to that, Jesse, people might like to see that. Um, Courtney Gray, seems like you made up your mind before you came, Stephen. Don't stop searching. That's what I say. Look until you feel comfortable, and don't just look until you find something that validates what you believe. Question your belief, challenge it. You know, we all challenged what we believed strongly to be true. And the thing is, this has nothing to do with belief. This has to do with science. So the science is very clear. Vaccines are not as safe as we've been told they are, nor are they effective. Um, so, yeah, no, Stavros, I know you're not trying to troll me. It's just that your question is too long for me to actually go through right now. I have this wonderful piece that was written by Greg Brown that I was going to read out, and I just don't have time. It's already after 9. So I promise that I will read your question and I will write back to you, and I hope that's okay. And we may do another Q&A. If you guys like what happened tonight, then I'm hoping that we will do another Q&A. Oh, Amber, thank you so much for sharing the link to that movie. I'm assuming that's the vitamin movie. Um, and this video covers the misinformation about deaths in Italy. Thank you for sharing that too. I don't think I've seen that one. I'm not sure, unless that's the High Wire. But yeah, and I recommend highly that everybody watch last week's High Wire if you're interested in the coronavirus issue. Dell does a fantastic job every time, but last week was especially good. And he had a talk with Toby Rogers, who is that economist um, who had some fantastic things to say about coronavirus and some really distressing things to say about the effects of the shutdown on health and on everything, our world. Oh, it's an interview. Okay, thanks, Amber. I will check it out. Amber shared a couple of video links here, so if anybody wants to look at it, that would be great. It was immediately before she spent 2 months in Europe. Interesting. Very interesting, Mandy. And you've got to think there should be a connection there, especially with the articles coming out to show a 36% increased risk of that sort of infection after flu vaccination. Adam said, I trusted the government and vaccinated my children and live with the regret every day. Me too. It's something that I think, you know, my kids went to a Steiner school, and though I never studied anthroposophy, it's something that I've looked into a bit. And Rudolf Steiner says that our children choose us, and they choose us because they want to live with us, but they also choose us to teach us. And I know that I've learned more from my children than I've ever taught them. And my son taught me about the risks of vaccinations. And it took me a little while to listen. I didn't stop vaccinating straight away, but I feel like he was my teacher much more than I ever was his. And I think that we need to listen to our children, and especially our babies. The only way they know how to communicate with us is by their crying, their responses, their reactions. So we need to be paying attention to that and not necessarily believing it when a doctor tells us that when a child has seizures or screams for 12 hours or breaks out in a head to toe eczema, that that's perfectly normal, because it's not. And we need to have that self-confidence to believe it. Oh, she was hospitalized upon returning. Is she? I hope she's okay now. Um, Yep. And Courtney, thank you so much for sharing the link to the High Wire. I highly recommend everyone watch it. It was quite long last week, but do it in pieces if you have to, but do watch it. There's the vitamin movie. And Mandy, COVID-19 maybe is an adverse reaction. That's the thing. Just because we find a virus in our body doesn't mean that the virus is the cause of the symptoms, especially since we know that our bodies create viruses. Maybe, just maybe, the virus is there to help us get rid of whatever is causing these symptoms. And by suppressing viruses, we could be making things worse. I don't know. And I don't think anybody knows. But I think that's just as logical and reasonable as it is to think that COVID-19 is caused by SARS-CoV-2. And that's the only cause for this, because the symptoms are identical to the symptoms of many other infections. And that is another interesting thing. I really want you guys to watch the interview that I did with Loretta Bolgan, because what she described taking place in Italy is a completely different set of symptoms. They are not getting the upper respiratory symptoms. They are getting gut symptoms. That starts with gut symptoms, and then it can go on to encephalitis, brain symptoms. It travels to the brain, she said. So it's a totally different set of symptoms, and yet they're saying it's the same virus that's causing it. I don't know the explanation for that. She doesn't know the explanation for that, but it is interesting. And she said she thinks the environment has a lot to do with it. Please let us all know what we can do tomorrow to make changes. I'm so passionate about this subject, researching for 15 years. I'm so lucky my mother had researched the dangers of vaccination, and I'm so proud to say that I've never had one, nor my children. Good on you, Heidi, and I bet your kids and you are very, very healthy. Um, let you know tomorrow what we can do to make changes. Follow the AVN Facebook page, because we will be putting a lot of information up there, but I'm also going to put a link here. Anybody who would like to help with the AVN, we have a volunteer, uh, what is the word? A form where you can fill out information about what it is you would like to do, what you can offer as far as helping the AVN goes. So anybody who would like to become a volunteer and to give us your support and your help, please click on that link, fill in the form. We are having a lot of trouble getting back to everybody because we have so many people who've written in. We have volunteers contacting volunteers. So, but we would love to have you work with us. And one of the other things, and I've mentioned this over the weekend, and we have been run off our feet in a really good way. We have not the AVN, because we don't run these groups. These are grassroots groups. Every community, basically, in Australia has a group within a half an hour. I'm not talking about Alice Springs. They may have groups there. I don't know about that. But every urban and rural area in Australia has groups of people who work together. And what we're hoping is that these groups become really strong and can do the grassroots activism that will be necessary to protect our health and prevent compulsory vaccination, which is maybe 9 to 12 months down the track. So, if you would like to be in touch with the group near you, send a private message to the page. Please don't put this information here. Send a private message to the page with your phone number, your email address, and the state and suburb that you live in. We will send that information to the team leaders in your area, and they will be in contact. A lot of people are saying that it's taking 2 or 3 or 4 days to be contacted by the team leaders, and that's because so many people have been getting into contact, and that's fantastic. We need to have tens of thousands of people involved in these groups because then we will be a force to be reckoned with. We know that there are tens of thousands and probably hundreds of thousands of people in Australia who question the safety and effectiveness of vaccination. We need to get together. And if you are afraid of being an activist, what's a better way to be an activist than with many other activists? There is courage in numbers and strength in numbers. So let's do that. Um, there we go. Interesting about the gut. Now I am worried. I have had strange gut issues lately. I mean, the gut is the seat of our immune system. It's where everything that makes us healthy lives. So if you're concerned about your gut, maybe you need to do something about it. Maybe you need to see a naturopath or a natural therapist who you trust. But just because you had gut issues doesn't mean that it's COVID-19. And even if it is treatable. So, yeah, don't be concerned because being worried is also immune suppressive. Everything negative is immune suppressive, everything positive supports your immune system. So, um, if you think you've got a problem, get it seen to and do what's necessary to bring your body into homeostasis. And I'm not one to talk because I mean, yeah, stress is what I live with, and that's not a good thing either. But I do the best I can. We all do the best we can. And I am motivated and inspired by people who are working on this issue. So send me some of that great motivation, people, because I really need it. Okay. and at this point, I think I've answered. Oh, Melanie, yes, we can do it. Um, I think I've answered all the questions except for Stavros and except for what was the third question? I can't remember who that was. Oh, Bruce. Bruce, I am going to see if I can get James Lyons Wheeler on very soon onto Under the Wire to deal with those issues. And Bruce, I will read through that information. I may not do it tonight because I'm a little tired, to be honest with you, but I will do it tomorrow morning. And I promise, 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 I will get back to you with what I think after I've read it through. Okay? All right. Everyone, have the very best night. Um, be healthy, be happy, be strong, and I will be seeing you soon. Okay? Take care. Good night.